Hi everyone, and thanks for joining us for today's Facebook Live. We are joining you from Rochester Regional Health's Mobile Mammography Center, which is right behind us. It travels around to different areas in Monroe County and outside counties to help people get their mammograms, most importantly for early detection of breast cancer. We're going to be talking to a couple people today who have a big part to play when it comes to the mobile. We're going to call it the Mobile Mammo Center behind me because I find it to be a bit of a tongue twister. But Tanya Brooks is joining us first, the Mobile Mammography Program Manager. Tanya, just to start, can you tell me exactly what happens on the Mobile Mammo Center, what is offered for patients?
So we provide mammograms for women 40 and over. And they get their mammogram, which should be done every year. And we just basically screen them like you would do in any image center around Monroe County.
How long does it take when someone walks on the bus? How much time do they need to set aside for it?
So it takes approximately 15 minutes. Once you get in, take off your shirt, get back there, get your screen in, put your shirt back on, and get off the coach. It should be about 15 minutes.
How long have you been involved with working on the Mobile Mammo Center?
From the very start. So we actually help build the coach. We actually help design the coach. We actually help put the layout the way we want it. You know, we don't have a bathroom on the coach for a specific reason because we're women and we know what that means. So we, from the very start, our first screening was August 2018, and we did it at Andrews Terrace, which is a senior citizen apartment for Pathstone. So that was our very first, and we have been doing it ever since.
What are some of the benefits for people with the Mobile Mammo bus? I mean, it goes around to different counties. The whole goal is to make care more easy and accessible. Can you talk about the benefits to it?
So it was initially we were looking at to make sure that patients that did not have a center close to them would we have that accessibility. What we are finding out is the convenience of it. So you may have like over at U of R. The U of R Strong is right there in the 19th Ward. We go over there about 4 or 5 times a month because you still got to go over to the bridge. If you have kids at home or you're getting off work late, sometimes it becomes hard. So the convenience of the mobile coach has actually been a selling point for most women.
How can people know where it's going to be, where and when it's going to be, and do they have to make an appointment or can they just walk up if they know where it's going to be located?
So two-part question. One, you go to our website. It's www.rochesterregional.com/pink. It'll tell you exactly where we're at. And you do not have to have an appointment, and you do not have to have insurance. You just come right up, you call, because of COVID protocols, you have to call and just tell them you want to do a mammogram, and they'll get you right in.
Now, this has been going on since we said 2017. If someone got their mammogram on the Mobile Mammo Center back then, and now they wanted to come this year and utilize it, is there anything different with COVID in play?
Yeah, it's a little bit different. The biggest difference is you have to do your check-in from your car. So you call from your car to let them know you're there. Mm-hmm. You cannot bring anyone on the coach with you. We don't utilize our waiting room. So once they call and tell you to come on the coach, they put you right into the dressing room. So then you go right in to get your mammogram. So the biggest difference is only that you don't wait on the coach. You wait in your car.
From all the people that you've seen over the years that have come on the Mobile Mammo Center to get a screening, is there anything that stands out to you? Do people express how it has made their life easier in some way to have this center to go to?
The two biggest examples would be when we go to the senior apartments. They love it. They love that they just come out their apartment, get their screening, and go back in. We do our 3 biggest ones are the 2 Pathstones here in Monroe County, and we do one in Ontario County, where the elderly, they actually call and ask us when are we coming back, and we put them on the schedule a year in advance because they want to make sure that they're on the schedule for the time that we go. So it's a convenience. And secondly, I would say that when we go down to Steuben County, the nearest image center to them could be almost an hour, 2 hours away. So the mere fact that they were right in the heart of their city and they could come get their screening done, whether we're at the library or at one of the employers, they love it. Oh, and there's also when we go to the employers, we have actually driven inside a GM and sat there for 2 days just screening their patients. So it's just really the convenience of getting it done, and a woman don't have to take off half a day to go get their screening.
And for anyone tuning in, how widespread, is this in terms of location? How many locations or counties, I should say, does this bus go to or the center go to?
So we do 8 counties. We do Monroe, Wayne, Livingston, Yates, Steuben, Seneca, Ontario, and Cayuga. All 8.
That was impressive. Can anyone can you request a location?
Yes. So anybody, it could be any corporation or retail, anybody with a facility that we could park at, they can request it. And even if you don't have somewhere for us to park, if you let us know, we can find parking around your area that will come out anywhere.
Tanya, is there anything that I haven't asked specifically that you wanted to add?
So I would like everyone to know that retailers, employers especially, we could come out and provide screening alongside with a lot of contract workers now. We work with Cancer Service Program that provide insurance for patients who do not have insurance. So this is the best time for us to get out there and get the screening done.
Okay. Tanya, thank you so much. We're going to head over to our next guest this afternoon, who is Diane Kush. She is the operations manager for ambulatory imaging. Diane, first and foremost, I want to ask you the importance of getting that yearly mammogram. There are a lot of people out there, they may think my schedule's too busy, or that, I just can't get to it for whatever the reason might be. Just how important it is, especially for early detection with breast cancer.
Yeah, so we as women always put things and people before us. And the importance of mammo is the sooner we can find an abnormality, the easier it is to treat. So, finding it as small as we can, that's the objective. And, so waiting in between mammos too long, it just makes things grow. And we like to see things when they're small.
What have you learned about, over the last couple of years, how much the Mobile Mammo Center has been able to help people, especially with that convenience factor?
It is, the patients, when I see them come on the coach, they are always so happy to be there. Thank you for coming to my neighborhood. Thank you for making it convenient for me. We just see that, hear that all the time when we're out on the road. So,
I was going to say, are there any specific examples that stand out to you? Any specific, patient or participant that came on the center that stands out?
Yeah. So, one of the very first patients that I chatted with, who had been on the coach, it was the first time that we had gone out, and in talking with her, again, she was very appreciative and so forth, and I ended up seeing her at one of our fixed locations. The coach only does screening exams, so if there's something that is found, then they will come to one of the fixed locations, and we will do further workup. So she happened to come into a site that I oversee, and in talking with her, she had mentioned that she secretly had a lump and she did not share that with the technologist. So she was just afraid and wanted to believe it wasn't there. So her treatment was, because of the coach. That's what initiated her, was that it was there in her neighborhood.
And I have to assume it's some of those things that make you love what you do.
Absolutely. I've been doing mammo for a very long time, and just to see the changes in the imaging technology, the equipment is better than it's ever been before. The treatment for breast cancer is much better than it has been before, so it's a way for us to help patients be identified, having an abnormality, and getting it treated. And that's the whole, gist of it, is to get people help.
Can you talk about the technology on the center? Some people might think, am I going to get the same type of care on a transportation vehicle as I would somewhere else?
Yeah, so this is the exact same imaging equipment that we have at our fixed locations. It is a top-notch piece of equipment. There are 2D mammography and there's 3D mammography. 3D is more of a newer technology. I say newer, it's probably been around 9-10 years now, but not all offices or facilities offer that. So the 3D mammography is the best, and the coach has that no different than our other site. So, we can't do a halfway job. We want the best.
And who qualifies, this might be the same answer, who qualifies for a mammogram, and at what age should you start thinking about needing to go get your first one?
Sure. So if you're coming on the coach, you need to have no symptoms for any type of breast imaging. It is a screening facility only, and women who are age 40 and older should have mammograms every year. It's not something that you should skip, because we have seen, unfortunately, patients last year with all of the pandemic put things off, and they come now this year and things have progressed. And so we want to encourage everyone to have their mammogram 40 and older every year. I get a lot of questions about, when do I stop? And when do you stop? There's really a conversation between a patient and their physician. It just depends on your health condition and other things. When women start to get, in their 70s, 80s, that's a discussion with their doctor. But the American College of Radiology is who we, as an imaging facility, who we look to for guidance, and their guidance is annual mammograms.
And if you detect a lump, we're supposed to do self-exams at home. If you detect a lump yourself, what you were saying is you should not be coming to the center. Instead, you should be calling your provider.
You should call your provider. They will set you up with an appointment at one of our fixed locations. And the reason why we do that is the fixed location has a radiologist that's there on site. They're guiding the technologist on what images are needed. Not everybody gets the same cookie cutter images, so it depends on where it is and what they see and whether they need an ultrasound. And that's all done where the radiologists are at the fixed location.
Diane, is there anything else that you want to add that I haven't asked you?
October's breast cancer awareness. Let's see as many of you women in for your mammo as we can.
Awesome. Thank you so much. And we have one more guest to talk to before we leave today. We have Ebony Caldwell, who is the Diversity, Inclusion, and Equity System Director. I think I use those words interchangeably, but nonetheless, Ebony, there are many benefits to the Mobile Mammo Center, from providing an accessible way for people to get those annual mammograms, finding potential early detection. But there's another one, which is equal access to care opportunity that this Mobile Mammo Center provides. Can you go into detail about the equal access to care aspect that the center offers?
Absolutely. And so the Rochester Regional Health's true north is health equity, and we talk about that all the time. And the Mobile Mammo Center allows us to actually meet people where they are. We talk about that a lot in DEI, but this is actually putting theory to practice, where we're meeting people in the neighborhoods where they may have trouble with transportation. They may have trouble with finances to pay for the screening. They may have trouble with understanding what's happening. And so this is a smaller unit where they can find in their communities throughout the year, not just for Breast Cancer Awareness Month, and then they can get the service that they need, those vital screenings that help us with early detection and better treatment, so that we can find health equity. And especially for women of color. We want it for all women, but women of color, we know that cancer is one of the top 3 leading causes of death for people, communities of color. And so we want to make sure that we're raising the awareness. We take every opportunity to provide support and education to vulnerable communities. And this is one of the ways we can do it, by partnering with the Mobile Mammo unit.
I was going to say, by having resources such as this one, how is it able to change certain people's lives, from an accessibility standpoint, but just overall?
Right, and so what I've seen here at the College of Health Careers is that it makes it convenient, right? You can do it on a lunch hour. You can do it if you're coming over to run to Target. You can stop and then get that vital screening that you need. So we're inviting all women to make sure that you get your breast screening. You sign up for your first appointment, your first one in a long time, or your annual screening. And the Mobile Mammography Center is doing this not only this month, but throughout the year. And we're encouraging women to make sure that they get their breast cancer screening.
How can this change? So have you talked to certain people about how having resources like this available? Sorry, there are birds flying in the background if you see our eyes opening really high. How having something like this really impacts someone? How does someone, by going to the underserved communities, if they think they might not get this kind of care originally and they find out that the bus is coming, I guess, do you have any experiences with people talking about what that means to them?
Yes, and so it walks them through a process that might be scary in a big hospital or in a big breast cancer center, right? This offers a smaller venue where they're offering counseling when you're setting up the appointment, as well as when you're in the mammo bus, to understand what's happening as it's happening and what you need for follow-up. And so I think that sometimes that can make a difference as well.
Is there anything that I haven't asked you specifically that you want to make sure to add?
No, I just want to make sure that we're promoting Breast Cancer Awareness Month in October, but we want to make sure that we're thinking about this all year long because, like I said, cancer is one of the leading causes of death in communities of color, and we want to make sure that people have the awareness and they have the access to get the best care possible, and Rochester Regional Health is one way to do that.
Thank you, Ebony. And for that awareness and access, on our website, there is a calendar of, we're at the college, we're at the Skyview at the Ridge, the Old Irondequoit Mall today in front of the College of Health Careers. That's where the Mobile Mammo, it's a lot of words. Yes. That's where the Mobile Mammography Center is today, but it's in a different location, as we talked about with Tanya, different counties that it visits to. And it's not, I want to make a point, it's not just October that the Mobile Mammography Center is out and about. It's all year long, but we are highlighting this as part of Breast Cancer Awareness Month this year. Ways that we're able to have the Mobile Mammography Center is by way of different funds and grants. So in order to leave a donation of any kind, we will have that link up for you on our screen. Also, if you're looking for information on how to book an appointment, not necessary but recommended to book an appointment or look at the schedule, you can head to pink.rochesterregional.org. Everyone, thank you so much for tuning in. If you have any questions about anything we talked about today with any of our guests, please leave those questions in our comment section and our experts will get back to you at a later time.